Hi everyone, this is Dr. Virginia Ellis. I am a dentist who practices general and cosmetic dentistry in a town called Orinda, which is in Northern California, close to the San Francisco city. So today what we're going to do is we are going to go over how to properly brush your teeth with a manual toothbrush. And before we do that, let's go ahead and click on the like button for your YouTube channel. That way we can let other people know how to find this information who want to improve the quality of their lives by improving their dental health. All right, number one, you should be brushing your teeth for at least 2 minutes. 2 minutes is the average recommended time. If you want to take longer, take longer. I take longer. I take about 4 minutes, and I do it once a day. But you know what? Well done once a day is better than halfway done or poorly done 3-4 times a day. So that really does make a difference. It's the quality of your brushing, not the quantity, the number of times you do it, okay? All right, so 2 minutes is a minimum. Don't do it for less than 2, do at least 2. If you need more time, take as long as you need. The other thing is develop a system. The system you want to develop is, let me start in this area here, go over here, go over here. So that way you're reaching all of the areas. We're going to start, let's say, the system we're going to use for today. You find out what works for you and stick to that. And then once you're doing that, ask your hygienist when you go for your checkups and your cleanings. Ask the doctor, how am I doing? How's it looking? Because that's how you're really going to know how well you're cleaning your teeth. One of the things that people have a misconception about is like, oh, I'm cleaning my teeth great, my gums are healthy, but you really don't know until you go in for a checkup and the doctor and the hygienist do their detailed exam and give you feedback and are able to see facts, areas that you're missing. That's how you'll really know, when you get feedback from your dental professional, okay? All right, so let's start. Let's pretend we're gonna start with our upper right side. What you wanna do is you angle the toothbrush 45 degrees, okay? The reason for that is because when you do 45 degrees, you're less likely to miss the gum line. You see how over here, yep, over here, we got not the gum line. You wanna get the gum line because you also wanna get, and you wanna go little circles, okay? You're gonna go 45 degrees, little circles here, and then you're gonna go like this, little circles. You are going to go little circles. Remember, angle so that you're reaching the gum line, okay? And then what you wanna do is you flip the toothbrush and you wanna make sure that you're doing 45 degrees, okay? Little circles like this, okay? When you get to this area here on the front teeth, I have noticed more so for the bottom and the uppers, you wanna kinda angle this vertically. Don't do it horizontally, because if you do it horizontally, you're likely to miss. Let me see. Let's flip over here. Your front teeth, and especially at the lower teeth, look what happens. See, you're doing this, there's no way to reach that. So the way to compensate for that is hold it vertically, little circles, soft, and then angle little circles, okay? And then you're gonna go down over here. Make sure you're angling 45 degrees this way, okay? And I'm gonna show you, I'll show you on the left side. See, there's a difference between doing this and a difference between doing that, because you do not want to miss the gum line. That's really, really, really important, okay? So here we go. So you're 45 degrees, little circles, and you're going over here at the front. We'll talk about the front in a little bit. Over here, right? And then flip. Make sure you kind of brush this area too. And then little circles. Again, do not go horizontally with a toothbrush. You want to go vertically, okay? Vertically, let's see. Little circles here. A lot of people get tartar here because they don't clean well. You have salivary glands that release a lot of minerals that harden the plaque, the creamy stuff, and turn it solid. Okay, there we go. And you want to go little circles, and that's it, about 2 minutes, okay? A common thing that I see people making mistakes on is when they're brushing this area, sometimes they go like this and they push the toothbrush up. And when you do that, when you're pushing the toothbrush up, they do a really good job of brushing this area. It gives them a false sense of cleanliness. And then if you just pull the lip down, you'll see that there's a lot of stuff being missed, and you'll know because your gums will be like puffy and red, and this area will have a lot of creamy stuff, like it's called plaque. So you want to make sure that you're really reaching this area. One of the things you can do is just pull your lip down and just gently do this, okay? And do it in front of a mirror. If you have access to a mirror, use a mirror, because when you use a mirror with your toothbrush, when you're brushing your teeth, you're gonna get a really good idea of how to reach those areas, and also keep in mind what it feels like when you're properly brushing your teeth. When you're done brushing your teeth and you rinse, take your tongue and just kind of go around. If your teeth feel smooth, you know you've removed the plaque, that creamy, clear, slimy layer that has the bacteria. If it doesn't feel smooth, like pearly smooth, go back and clean that area again. All right, again, if you found this information useful, please do click on the like button to let others know about our channel and to help other people get into better dental health. All right, I'll see you at the next video. The next thing I'm going to be talking about, if you happen to be using an electric toothbrush that may look something like this, we're going to go over that technique, because the way you use this type of toothbrush and the way you use that type of toothbrush, completely different technique. All right, I'll see you at the next video. Bye-bye.